Hello, this is going to be a recap of what we did for Release, Breathe, and Restore at the end of January. And we focused on the spine. This is going to be a segment that's going to be focusing on the lower back area. There is another video with specifics as to where exactly the balls will go. Because we're going to be laying down, just briefly, what you're going to need are one block and either 2 yoga tune-up balls or 2 tennis balls. Tennis balls are going to be a little bit better than lacrosse balls if you don't have specific therapy balls. If you have a different set of release tools that you like, go ahead and use those. These yoga therapy tune-up balls are made for self-massage or self-myofascial release, so that's what they're made for. That's what we're going to use them for. The areas that you're going to release are around the low back. So we're going to start at the PSIS, which are these bony points. Some of us have dimples there. We're going to start with one ball on each side around that area. We'll spend a little bit of time there. We'll then move into the flesh of the glutes. There's a lot of muscles in here. We have some big muscles, some little muscles. Some of it will feel good, some of it will feel tight. Listen to your body. Then we're going to come back in around the PSIS and just be a little bit more specific around there. So maybe explore in or out or up. This isn't the area that's around your SI joint, so listen to how your body responds to that. You'll then move with the 2 balls pretty much touching so that it creates a little bit of space for your spine or your spinous processes. And you'll move the balls slowly from your iliac crest up your spine. You can come back down and then check out along the iliac crest. This is an attachment point, again, of a lot of muscles of our low back, our glutes. So this can be a sensitive area. Listen to how it feels. Coming up again, you'll then find your 12th rib. You can again find that with your fingers so you know where you're going. The 12th rib is floating and is relatively short. It does not feel great to push directly on it, so relatively stay below it. Listen to those sharp sensations. From there, you'll stay kind of in mid-back and roll down back to the iliac crest. So those are the places that we'll be releasing, and we'll be doing some other moves and kind of assessments along the way, but just so you have an idea, since that will be on the ground. Where you'll start is laying on your back with your block close by so you don't have to reach too far as you get into position. And so we'll simply just start by laying on our back, letting your eyes close, taking a breath and arriving here. You can sigh out your exhale, create a Ujjayi breath. Let go of anything that you've been holding. Let go of the weight of your head, the holding of your shoulders, and allow yourself to rest here. We're not working against gravity, and instead gravity is working with us here, allowing us to settle and ground. And just scan through your body. Notice how you're feeling. Since we're going to be checking in or doing some release work around the low back, you might specifically check in with how your pelvis is settling. How bony does that area feel, or how soft does it feel? Noticing what the space of your low back is. You don't have to use your hands. I'm just doing this to demo and show where we are. Try to use the finger of your brain, your mind's eye. And then also just noticing how much of your rib cage is down. So again, our rib cage comes down pretty low around waistline. And sometimes we have a lot of space underneath our rib cage. So just check in if that's the case for you. As your breath settles, let your mind settle. Sometimes that takes a little bit longer to quiet, but again, check in with how that's feeling. Some low back tension or stress or just general stress and holding in our body can be related to our mental tension. And then once you get a good idea of where you're starting from, take your block at its low height, lift your hips up, and then slide the block underneath so the top edge of the block is pretty much right at those PSIS. The block is being very supportive to the sacrum and your pelvis. It is not on the movable lumbar spine. It's instead below that. And just get it centered, feel comfortable there. Again, take another couple of breaths here. Paying a little bit more attention to release around the front of your hips, maybe even inner thighs. And with the pressure or the support on the sacrum, sometimes there's some settling that happens there, again, around the SI joint, around the pelvis. Allow that to happen and listen to your body. If there's ever anything that feels too intense or too much or a little bit like a red flag, then listen to your body. Your body is always in charge. As you settle here in this supported bridge, decide what kind of movements might feel good. Try a small tuck and tilt. And doing this small, what we're doing here is allowing some time for, again, some of these places where we hold tension to release before we go into releasing with the balls. You might do a little rock from side to side as if one knee was reaching over to the opposite foot. And then you could also try seeing how it feels, as long as it's not too straining for your shoulders or your upper body. March one leg up, lower it down, alternating sides. Seeing if that movement can really truly come from your hip joint, noticing that the pelvis is trying to remain still. So we're not making the move so big that we round the low back and tuck the pelvis. We're trying not to make the move so far out that we're tipping the pelvis forward and arching the back. And then again, if it feels okay, lifting one leg up, maintaining it there, bringing the other leg up to meet it, and then as if your knees were together, as if you just had one leg, rock your knees from side to side, 11 o'clock to 1 o'clock. Very small, pretty subtle again. If you can feel your PSIS on the back, whatever you're on, it's as if you're just rocking from one PSIS to the other PSIS. Again, this is right around the SI joint, so kind of one side of the SI joint to the other SI joint. And then as you're ready, over to one side, just draw very small circles, as if your knees were drawing circles on the ceiling. You can decide how active your legs are. Your shins can be parallel to the ground, or you can just completely let your feet drop. Listen to what feels better for you. And then other directions, small circles. And then other sides. We're doing maybe 3 or 5 on each side. Listen to how it feels. Other direction. And then back to center, hands on knees. And from here, keep your arms relatively straight and then tuck your pelvis under and tilt your pelvis forward. So you're trying to move your pelvis underneath your thighs, and your hands are here as a reminder that it's not your knees driving this motion, not your hips driving this motion, but instead your pelvis. Very small, very subtle. Sometimes this can be a little frustrating at the beginning as you learn it. And then as you're ready, release your hands, one leg down at a time. Take another breath here. See how you feel. Because we've just done all of that releasing, we're going to do a little breathing first, and then we'll get into doing some more specific release work. So here, taking your hands onto your lower rib cage, as you inhale, try to imagine that your rib cage is opening, your fingers are going away from each other. And as you exhale, bring your fingers and your ribs closer together. You can breathe out through an open mouth or a closed mouth. Inhale, widening. Exhale, narrowing or closing. One more breath like that. See if you can maintain a little bit of that narrowing or closing so that you feel active in your abs, your upper abdominals, and then give a small tuck of the pelvis. And here, even as you're holding your ribs, you should be able to breathe. So find what you can there. Tuck of the pelvis. So now ribs and hips, ribs are narrowed, ribs and hip points are closer together. And then see if you can press into your heels and even pull your heels towards you to come up using areas other than your back. Sometimes we use our back, lifting up and then rolling down, taking your time, one vertebrae at a time if you can. Taking a moment to pause at the bottom. Once again, inhale, widen the ribs. Exhale, narrow the ribs. Hold that, maintain that without bracing, feeling like you can breathe. Tuck your pelvis. Once again, press through your heels, pull your heels towards you, lift up. You choose how high in the bridge you go, and roll back down. And then this is a little bit of an assessment. We'll do that one more time, just seeing how you feel. Inhale, widen the ribs. Exhale, narrow. Gentle tuck of the pelvis. Pull and activate your heels, lifting up. I'm not making this the biggest bridge I've ever done, but just giving some activation and then rolling down, noticing how that feels. We'll then go through and do all of the release work with the Therapy Plus balls or whatever balls you're using, and then we'll reassess that bridge. So again, we're starting with one ball on each side at PSIS. It doesn't feel great to be directly on that bony point, so again, move somewhere, maybe off to the outer sides of it, but listen to your own body. Similar to what we did on the block, start to move around here. So that could be a tuck and a tilt. It could be that knee reaching over to opposite foot. And then since we're on two balls, we can also just kind of slide hips from side to side. Even a hike of one hip going down, one side of the hip, or really pelvis going up. And then as you're ready, move the balls out and down just a little bit. So we're in the flesh of the glutes, and you'll decide and you'll figure out how wide you can go. The wider you go, the more your body will come closer to the ground. So there is a certain width that's a little bit too far. And then as you move again in any direction, the balls will migrate and move. So use your hands to bring them back under. And what we're looking for here are things that feel maybe like they need a little bit more attention, but that overall it feels good. This is not to torture. This is again to release, to let go. If anything feels like it's creating gripping or you're tense somewhere in your body, your fingers, your toes, your eyes, move to a different spot or use your breath. Try to settle. And so we're just exploring this whole area, the flesh of our glutes and this whole back side of our hip and buttocks comes up higher than we think. So move the balls maybe even up a little higher than you might think until you get to just below your iliac crest. You can feel your iliac crest, and you're going to be just below that. And then as you're ready, coming back to the PSIS, maybe going a little bit lower than the PSIS or a little bit higher, just exploring that area in a little bit more detail. We all have different places that feel better than others or places that feel tight and need the attention. This is a time for you to explore and get to know your own body and your own patterns. And then from the PSIS, moving up. So the two balls are touching. You can choose to do this directly on your skin or have your shirt down, whichever feels better. Having the balls directly on the skin does give a little bit more feedback. Here, the muscles along the spine are big and cabley, so side to side can feel nice. You might even feel a little kind of speed bump on each side. And again, you can tuck and tilt your pelvis. Sometimes that feels good, sometimes it doesn't, depending on how kind of tender or tense your back is. And just moving the balls up until you get to about the 12th rib. You might have to use your hands to figure out where that is. Again, your mind's eye can also give you some feedback using your own proprioception, mapping your body. And I tend to keep my pelvis off the ground. It does not have to be though. If the pelvis comes down, however, it does create an arch in the back, and so listen to how you respond to that. If you don't like holding your hips up, you can always put your hands underneath to give a little support. You could also put like a rolled blanket or towel to give some support as you're doing this. And then just slowly move the balls back down. So we have our thoracolumbar fascia here, where all of our muscles of our back come in and attach into, especially our lat, a big muscle on the back. Deep to that, we have our Again, our muscles that move along our spine, what are called our erector spinae, our spinal erectors. And then once you get back down to the PSIS, move out along now the top of the iliac crest. So we did below the iliac crest, now we're doing above. Some of our obliques come in and attach into here. And this, we can think of this area as our flank. This area tends to be a little bit sensitive. I mostly like to go side to side, but you can always do anything else that feels good. And simply just pausing is another option. So if you find a place where it's just like, just wanting to let go, use that, take advantage of that. As you make your way out, again, you'll get to a certain width that feels like you've kind of lost the balls or your body has come down. Return back to center. The two balls are touching each other right at your spine, moving back up your spine. Getting to the 12th rib. And then from there, moving the balls out, about halfway out to this very side of your body. And this area is, again, a lot of attachments coming together. And in particular, a very deep muscle here, our QL, our quadratus lumborum, that tends to kind of partner with the psoas and become a real stabilizer if our core or our glutes aren't kind of giving enough support. Or if we have rotations, right? All different reasons why we can have this, but a pretty common area to be tight. It can be a tender area. It's a pretty exposed area. So again, if this is your first time or you're new to this, some of these sensations might be a bit kind of overwhelming for your system. Back off as you need to, rest as you need to, take the balls out when you need to. And again, simply pause and breathe when you need to. Tucking the pelvis is a great thing to do here. The QL helps with an anterior tilt, so that'll tense that muscle or tighten that muscle. Tucking will actually give a gentle stretch. So see what that feels like. Tuck it, and then maybe see if you can move side to side and see if that provides a different sensation. Moving all the way back down to the iliac crest. And then once you get there, finding that wrap of your ribs, inhale, widen, exhale, narrow. And as we lift off the balls, again, find your heels, press down, pull in, gentle lift off, and then place the balls off to the side, roll back down. Things might feel different, check in, readjust if your shirt has moved in any way, and then once again, tuck the pelvis, inhale, widen, exhale, narrow. Find your heels, lift into whatever version of a bridge you want to come into, and roll back down. Noticing if the movement of your spine feels any different, if you can articulate any differently, if you can even come to neutral and feel different. One more. Inhale, widen. Exhale, narrow. Tuck the pelvis. Find your heels. Lift up. And then again, with ease, roll back down, coming through that tucked pelvis, and then returning to neutral. And then seeing if you can just stay here either with knees bent. This can be a constructive rest position. You can also place something underneath your knees or your legs. If you could come into a supported version of this, I'm showing this without any support, but a supported version of this, legs at 90-90, or something like a bolster, or even if you had two blocks, you could put one block under each thigh and straighten your legs out. But coming into a position of what we call constructive rest, where you can let it feel like your legs can relax, your area around your hips can relax, so you have no tension around your abdomen, your low back, or your hips. And just be here. You can let eyes close, easy breath now, and rest here for at least 3 to 5 breaths, but really for as long as you would like.